Hello and welcome to Measles, the Vaccine-Preventable disease. My name is Nicole Holmes and I am a provider training coordinator here at the Philadelphia Department of Public Health's immunization program. By the end of this training, you should be able to understand the history of the measles, mumps, and rubella, or MMR, vaccine, understand the United States MMR vaccine requirements, and understand the process for vaccinating travelers. And you're invited to turn on closed captioning at this time. We'll start with the background of measles, mumps, and rubella diseases and viruses, move into the history of the MMR vaccine, then the prevention of measles, mumps, and rubella diseases and viruses, followed by the recap of the presumptive approach, and we'll close with resources. Now, we'll get into the background of measles, mumps, and rubella. Measles, the first M, is a highly contagious disease. It spreads through the air when an infected person coughs or sneezes. At-risk population includes children under 5 years old and adults over 20 years old, pregnant women or people who are immunocompromised, and unvaccinated people. And measles was actually discovered by Persian physician Abu Bakr Muhammad Zakaria. It can take 7 to 14 days after an infection for symptoms to start to show. Symptoms can include fever, which may exceed 104 degrees Fahrenheit, a rash, which is initially flat, then becomes small raised bumps. Sometimes they're joined, and it spreads from the head to the rest of the body. Cough, conjunctivitis, also known as pink eye, runny nose, red, watery eyes, and complications can include diarrhea, pneumonia, brain inflammation, ear infection, and death. And I'd like to draw your attention to the bottom right of this slide. 95% of measles. That is the efficacy rate in vaccinated children after their first dose. It can take 7 to 14 days after an infection for symptoms to start to show. Symptoms can include fever, which may exceed 104 degrees Fahrenheit, a rash, which is initially flat, then becomes small raised bumps. Sometimes they're joined, and it spreads from the head to the rest of the body. Cough, conjunctivitis, also known as pink eye, runny nose, red, watery eyes, and complications can include diarrhea, pneumonia, brain inflammation, ear infection, and death. And I'd like to draw your attention to the bottom right of this slide. 95% of measles. That is the efficacy rate in vaccinated children after their first dose. Mumps, the second M, is a highly contagious viral infection which spreads through contact with saliva or respiratory droplets from the mouth, nose, or throat. The at-risk population includes school-aged children, post-high school educational institutions, healthcare personnel, people traveling abroad, and unvaccinated people. And if you draw your attention to the example image here, you'll notice that the parotid glands is what mumps affects. It can take 16 to 18 days for symptoms to show. Symptoms include swelling of the jaw or puffy cheeks, fever, fatigue, headache, appetite loss, and complications include orchitis, mastitis, pancreatitis, encephalitis, and meningitis. And again, if we look at our example, 96% is the efficacy rate in vaccinated children after first dose. Rubella, which is the R, is a contagious disease caused by a virus. It spreads through contact with saliva or respiratory droplets from the mouth, nose, throat, or from the mother to the baby during pregnancy. The at-risk population includes pregnant women or people, newborns, and unvaccinated people. And if you draw your attention to the sample image, you'll see this is an example of what rubella looks like. The incubation period of rubella virus is about 17 days, and symptoms include but may not appear in about 25% to 50% of people infected: sore throat, fever, cough, runny nose, rash on the face that spreads to the rest of the body, birth defects in newborns, and congenital rubella syndrome, also known as CRS. And complications in pregnant women and people and newborns include miscarriage, heart problems, eyesight and hearing loss, and intellectual disability and damage to liver or the spleen. And again, if we look at our sample image, we see that 99% of rubella. This is the efficacy rate in vaccinated children after their first dose. Now we'll get into the background of the MMR vaccine. We'll begin with a little history and facts. The first successful isolation for the measles virus was from David Edmonston's blood. The Edmonston B strain of measles virus was then developed, and soon thereafter, the Edmonston B strain of measles virus was transformed into the first MMR vaccine and was licensed in 1963. Now, many countries offer the standalone MMR vaccine, which does not include varicella. And people vaccinated with MMR will be protected for life. There's been quite a journey leading up to the MMR vaccines, and this timeline illustrates that journey and how it began in the 9th century, where measles was discovered by Persian physician Zachariah, and in 1757, measles was identified as an infectious agent in the blood. In 1765, measles was identified in the U.S. In 1954, there was a measles outbreak that occurred in a school in Massachusetts. And by the way, tens of thousands of children were affected by that. And in 1963, the MMR vaccine was distributed for use in the U.S. In 1971, the MMR combination vaccine was developed by Dr. Maurice Hillman. In 1978, the MMR2 combination vaccine was approved by the FDA for ages 12 months and older. In 1989, the MMR 2-dose series was recommended. In 2000, measles was actually declared eliminated from the U.S. And in 2005, the varicella vaccine was added to the MMR vaccine to create the MMR-V vaccine, which is the combined vaccine. And in 2022, the product Priorix was approved for use in people aged 12 months and older. And recently, the U.S. has been seeing several measles cases since 2024 and 2025, reversing the previous elimination of measles in the U.S. Now, needless to say, the global population is still at risk for contracting and spreading measles, mumps, and rubella. So we have to do our part. Now we'll move into the Advisory Committee on Immunization Practices, also known as the ACIP, recommended vaccine schedules for the MMR vaccine. Before we get into the schedules, here's a look at the state MMR vaccine requirements for grades K through 12. Now, the legend indicates that this vaccine is required for all 50 states, and this image was as of March 2023. Here's a look at the full list of ACIP recommended pediatric vaccines and dose series according to age. Here's a closer look at the ACIP recommendations for the MMR pediatric dose series. It's broken down by timeline and number of dose in the series. So if you draw your attention to the top of the screen, you'll notice many different months and years from birth to 18. Those highlighted with a red border correspond with the dose number below it, also highlighted with a red border. So let's break it down. The first dose should be administered at ages 12 months to 15 months old. The second dose should be administered at ages 4 through 6 years. Now, I want to draw your attention to the boxes highlighted with a yellow border that correspond with the dose number below it. It's always important to read the notes page for all ACIP recommended vaccines. Make sure to read each heading carefully. So for routine vaccinations, a 2-dose series is recommended. The first dose should be administered between ages 12 months and 15 months, and the second dose should be administered between ages 4 and 6 years old. The catch-up vaccination schedule is for unvaccinated children and adolescents. It is a recommended 2-dose series, and these doses should be administered at least 4 weeks apart. Now, remember, the maximum age for administering MMR-V, which is the MMR vaccine including varicella, is age 12. Now we're going to go ahead and jump back to the previously highlighted boxes on the full ACIP schedule. We're going to talk about special situations, which includes international travel. So, for infants aged 6 months to 11 months, they require 1 dose before departure. Now, that 1 dose is not to be included in their 2-dose series. If you read the notes here, it says you have to revaccinate with this 2-dose series, and you'll begin that revaccination between 12 months and 15 months. So for children aged 12 months and older who are unvaccinated, they'll be receiving the 2-dose series, and those doses will be separated by about 4 weeks before departure. And another note at the bottom says that if MMRV is used, the minimum interval between MMRV doses is 3 months. Here's a look at all the MMR vaccines currently offered. We'll start with the MMR2, which is indicated for people aged 12 months and older. So that includes your pediatric population and your adult population. Next, we have Priorix, which is indicated for people aged 12 months and older, also your pediatric population and adult population. And then finally, we have MMRV, which is a combination vaccine indicated exclusively for children aged 12 months through 12 years of age. It is pediatric vaccine only, and as you can see here, we have everything color-coded. So for the pediatric and adult vaccines, those are highlighted in blue, the top 2, and then we have the pediatric only vaccine, MMRV, which is highlighted in green. Next, we're going to look at the adult schedule, which is a bit different from the pediatric one. So here's a list of the full ACIP recommended adult vaccines and dose series according to age. And here's a closer look at the ACIP recommendations for the MMR adult dose series. Again, it's broken down by timeline and number of doses in the series. So if you draw your attention to the top of the screen, you'll notice many different months and years from ages 19 through 65 and older. Those highlighted with a red border correspond with the dose number below it, also highlighted with a red border. And now we'll jump right into the specifications. So here are the notes for adults. For a routine vaccination and no evidence of immunity to measles, mumps, or rubella, go ahead and administer 1 dose. But for patients born before 1957 and they're not healthcare personnel, they do not require vaccination. Now, for the special situations for the adult MMR dose series, it includes pregnancy and women or people who are not pregnant but of childbearing age with no evidence of immunity to rubella. It's recommended that 1 dose is administered. For severe immunocompromising conditions, MMR is contraindicated. For people infected with HIV, it's recommended to complete a 2-dose series. For students in post-secondary schooling and international travelers and people in close contact with the immunocompromised people or person, it's recommended to complete a 2-dose series. But be sure to read all the specifics on the notes as they are very informative and will lead you in the right direction. If you have any additional questions, we advise that you reach out to CDC for more information. Before international travel, it's important to remember that infants under 12 months should get an early first dose at 6 months to 11 months. Now, remember, this dose does not count toward the final dose series, and children will still need 2 more doses. First dose will be administered between ages 12 months and 15 months, and the second dose will be administered between ages 4 years and 6 years. Also, it's important to let your patients know to be fully vaccinated against measles at least 2 weeks before departure. And after international travel, it's important to tell your patients to monitor their health for 3 weeks after returning. And if they notice symptoms, they need to call their doctor immediately. Now we'll get into the travel guidelines for measles. As providers, you are tasked with ensuring your patients know what steps they're responsible for taking for their health. Be sure to explain to them the dangers in traveling abroad to countries where measles, mumps, or rubella is still present. Advise against traveling abroad when your patients are unvaccinated and that they should not travel if they're sick, but to call their doctor if they've been exposed to measles. If you have patients who are adamant about traveling still, tell them to monitor their health for approximately 3 weeks after travel and instruct them to call their doctor if any signs or symptoms start to appear. Now we're going to move into the presumptive approach, which is important to practice in all clinical settings. The first approach is positive assumption. Healthcare providers sometimes expect patients to agree with or accept recommendations like vaccines or lifestyle changes without needing much convincing. And that, of course, would be ideal, but sometimes you have to do a little more work to see results. The second presumptive approach is streamlined communication. This approach makes communication simpler by focusing on the likely positive outcome instead of potential objections. The third approach is encouraging engagement. Assuming a positive response encourages patients to take action more easily. So, for example, instead of asking a parent or a patient if they want a vaccine, the provider might say, "Let's schedule your vaccine today," or "Your child is due for MMR." The fourth approach is promoting adherence. This method can improve how well patients follow health advice by presenting recommendations as the norm, making it easier for patients to comply. To summarize the previous 2 slides, here's a nice infographic to illustrate the presumptive approach in 3 easy steps. First, safely assume parents will vaccinate their children. If parents consent with no further questions, go ahead and administer the recommended vaccine dose. If parents are not ready to vaccinate, move to the second step, which is give your strong recommendation. Here is where you remind or explain to the parent or patient that by vaccinating their child or themselves against MMR, they're protecting them from all the symptoms, complications, spreading the disease or virus, and that the vaccine is a school requirement. If the patient or the parents accept your recommendation, go ahead and administer the recommended vaccine dose. If the parents or the patient has specific questions or concerns, move on to the third step, which is listen and respond to the parents' or the patient's questions. Now, if the parent or patients respond positively to your answer, go ahead and administer the recommended dose. What a win. To further educate your patients, you can leave them with the Vaccine Information Statement, also known as the VIS. Now, this document should be on hand and offered to each of your patients. You want to always give them the choice to decline rather than assuming they won't want to read up a bit on the vaccine that they're due for or considering getting. Here's a recap of what we went over. The MMR vaccine can prevent measles, mumps, and rubella. Before travel, children between the ages of 6 months and 11 months should receive 1 MMR dose. Now, these children, the ones who have received the 1 MMR dose between ages 6 months and 11 months, still need the recommended 2-dose series. And that series will be administered the first dose between ages 12 months and 15 months, and the second dose between ages 4 years and 6 years. Children aged 12 months to 6 years should receive the 2-dose series. We've gone over that a few times. I think you probably have it down pat now. And people aged 15 to 45 should receive 1 dose. Now, depending on circumstances, some adults should receive the 2-dose series. And clinical providers should always use the presumptive approach when speaking to patients about vaccinations. The immunization program is here to help, and you have access to more information than you know. Visit our newly designed website to order more educational materials for your practice, classroom, or office at no cost to you. Head to vaccines.phila.gov and then in the search box, type in measles and then click enter on your keyboard. Or you can click on the menu in the top right and scroll down and click free print materials. This way, you can see what other materials we have available for order. Here's a snapshot of our current measles print materials. Go ahead and get them while they're hot. And here are the resources used, and just so viewers know, all information was pulled from reputable resources including the WHO.org, the CDC.gov, and immunize.org. Thanks so much for watching, and we'll see you in the next one.